So let us study today about pre-implantation genetic diagnosis. See, pre-implantation genetic means it is one of the advanced reproductive technology, so mainly used so that we want to study the genetic material before doing IVF procedures, so that any genetic abnormalities are there, we can identify it earlier. Hence, malformed or congenital deformation in a baby, genetically deformed baby, we can prevent. So what are the different types are there? So you have pre-implantation genetic testing for aneuploidy, pre-implantation genetic testing for monogenic disorder, pre-implantation genetic testing for structural rearrangement. See, here comes aneuploidy. Aneuploidy means any Down syndrome, Turner syndrome. So all these things you can detect. Monogenic disorder. Monogenic means any single gene defect like sickle cell anemia, thalassemia, cystic fibrosis. Structural rearrangements. Structural rearrangements means any inversion, deletion, addition, translocations, balanced translocation. All of this you can detect in structural rearrangements. Okay, so this is about the types pre-implantation genetic diagnosis. So what are the indication means mainly it is used in ART techniques, that is IVF technology, like if her mother age is very advanced age, or if the mother is having recurrent pregnancy losses, or there is severe oligoasthenoteratospermia, that is the whatever the severe male factor infertility is there, like sperm is having some different in motility, different in viability, different in the morphology, then we have to rule out the genetic deformity in the male factor also. Or if you want to look for any carrier, if there is carrier of any genetic diseases, to avoid that disease transmission to the offspring. And if there is repeated history of IVF failure, actually we will do it before doing the IVF, but if you are not done and directly went for IVF now, if there is repeated IVF failures, these are some of the indications where we will do pre-implantation genetic diagnosis. Okay, so then how do you do? So it is done in the IVF process. So embryo biopsy you can do, like blastocyst, you will on the day 5 or day 6 you take some cells from the ectoda and do embryo biopsy, and or you do genetic analysis like next generation sequencing. All those things I will write. See, so how do? You will do blastocyst, whatever is there, blastocyst, that embryo you will take, trophoectoderm you will take, and you will do the biopsy. You can do next generation sequencing, or you can do chromosomal array CGH, genomic hybridization, array genomic hybridization, or you can do DNA testing, or you can do even the PCR, and all of this test you can do, and then you will select whatever that particular genetically normal embryo, whatever is there, that you will select it, and then you will transfer this normal embryo. So because of doing this, we have very success in IVF rate, and it will, because of this we are not transferring any genetically malformed baby, that's why the risk of miscarriage also reduces. Repeated IVF failure has been reduced, and then transmission of the genetic diseases also going to reduce. And it but the disadvantages are, these are the advantages. When it comes to disadvantages, it is very costly and it is expensive, like it's not easily available. It will not guarantee the pregnancy. Just because the whatever the embryo is genetically normal doesn't mean it will not undergo abortion, so doesn't guarantee the pregnancy. Sometimes while you are taking the embryo biopsy, that may even harm the embryo. So there is some ethical concern, like you should not use this process for embryo selection or sex selection. So these are some point about pre-implantation genetic diagnosis. Thank you.